Bismillahirrahmanirrahim. Assalamualaikum and good day. So my name is Aminah Batrisha binti Karnizam and I will be presenting our article review. So first of all, why do crisis communication matters? So when crisis happen, the public will become panicked. So a good and a successful crisis communication can help to reduce panic among the public. Next, it helps to build trust. And when crisis happen, a good and a successful crisis communication can help to encourage the public to cooperate. Alright, moving on to the next part. Our article review use two general articles. So the first article is published on 2022 and the second article is published on 2026. So both of the articles are mainly about COVID-19, but it's focusing on different kind of aspect of communication strategies. Alright, moving on to the next part, which is the crisis development stage. For this article 1, moving on to the first one, which is the first stage, which is prodrome stage. Prodrome stage is the early signs. So for this article, the COVID-19, the virus is detected. That is prodrome stage. So, but the public awareness is still low. Next, the next stage is acute stage. That is when the COVID-19, the cases happen, the SOPs, the lockdowns, and moving on to the chronic stage, which is the long-term management phase, because the COVID-19 affected the economy, the society, and of course people's mental health. And then moving on to the last stage, which is the resolution stage. This is the recovery stage. The crisis is not solved yet, but it started to going back as it used to be normal. So as this article 1, the COVID-19 cases decreased, the government started to introduce the vaccine. That is the resolution stage. Moving on to the communication strategies. The first communication strategy that is mentioned in this article is denial. So denial is mean that you're downplaying the seriousness or denying the crisis. So article 1 mentioned that is not effective because it will make the public more doubt, and then it will decrease the public trust. And the second one is diminishment, is also very not effective according to the article 1, because it might work for a little while, because diminishment's communication strategy is that you're making the crisis less serious than it actually is. This is because it's kind of not effective, because it will confuse the public about the real danger. And then the third one is rebuilding. According to article 1, this is the most effective one because it can gain public trust. Rebuilding communication strategy is that when we give transparency, we give honest information to the public. And article 1 mentioned that the most effective strategy is rebuilding.
Hi, my name is Nur Izzadaruddin. My metric number is L2040361. Next, we will examine how the communication strategies relate to the theories discussed in our course. First, apologia theory. Explain how organizations defend or justify their action during a crisis. Government frequently explain why restriction and health measures were necessary to protect public safety. Second, image repair theory. Focus on restoring reputation after a crisis. Governments attempt to rebuild public confidence through corrective actions such as vaccinations programs, regular press conference, and continuous health updates. Third, decision and diffusion theory. This theory explains how information spread through society and influence people's decisions. Government use television, radio, newspaper, and social media to encourage preventive behaviors such as wearing masks and vaccination. Finally, excellence theory. This theory emphasized two-way communication and stakeholder engagement. Although governments provide frequent updates, opportunities for public feedback were limited, meaning communication remained largely one-directional. Overall, these theories help explain why transparent and accountable communication is more effective than denial or silence during a crisis. The pandemic produced significant long-term impacts. Organizations recognized the importance of crisis preparedness and invested in a better communication system. Stakeholders become more aware of the importance of obtaining information from credible sources. The crisis also strengthened the role of crisis communication as an essential function within both public and private organizations. The main lessons from this article is that transparency and trust should always be prioritized during emergency. The second article focused on Algeria communication planning during the COVID-19 pandemic. Before the outbreak, the government developed preparedness plan based on previous public health emergencies. When COVID-19 cases increased, authorities introduced health regulations, travel restrictions, and public awareness campaign. As the crisis intensified, communication focused on educating the public, managing rumors, and maintaining public confidence. Eventually, communication shifted towards recovery, evaluation, and future preparedness once the situation became more stable. The Algerian government employed several communication strategies throughout the pandemic. These include transparent information dissemination, media engagement, public awareness campaign, misinformation management, and collaborative with healthcare professionals. Although these strategies help improve public awareness, the study also identified several weaknesses. Communication was often one-way, stakeholder engagement was limited, and vulnerable communities experienced difficulties accessing important health information. Therefore, while the communication plan was comprehensive, implementation challenge reduced its overall effectiveness. Several communication theories can also be applied to the Algerian case. Using apologia theory, government officials justified restrictive policies by explaining that they were necessary to protect public health. According to image repair theory, authorities attempt to preserve their credibility through regular updates and corrective actions such as vaccination campaigns. Decision and division theory explain how repeated communication through multiple media platforms encourage citizens to adopt preventive health behaviors. Finally, excellence theory. This theory highlights one of the study's major weaknesses. Communication mainly flowed from the government to the public with limited opportunities for public dialogue or feedback. This suggests that future crisis communication should emphasize greater stakeholder participation and two-way communication.
Bismillah, my name is Mariam Sakinah binti Fuad. My matric number is L204B0705. Next, for the second article, long-term impact. The COVID-19 pandemic produced several long-term impacts on governments, organizations, and society. Governments recognized the importance of developing comprehensive crisis communication plans before emergency occur. Organizations invested in digital communication systems and improved crisis preparedness. At the same time, citizens become more aware of the importance of obtaining information from reliable and credible sources. Furthermore, for comparative analysis for both articles, although both articles examine crisis communication during COVID-19, they approach the topic differently. The first article focuses on communication strategies and their influence on public trust. The second article evaluates how communication plans were implemented at the national level. Despite these differences, both studies conclude that transparency, consistency, accountability, and stakeholder engagement are essential for successful crisis communication. Both articles also demonstrate that misinformation can seriously undermine public trust if not addressed effectively. Next, for recommendation, based on our review, we recommend several improvements. First, government should prioritize transparency throughout every stage of crisis. Second, communication should be two-way, allowing stakeholders to ask questions and provide feedback. Third, crisis communication plans should be developed before emergencies occur. Finally, misinformation should be monitored continuously through collaboration with healthcare professionals, media organizations, and community leaders. Finally, for conclusion, both articles demonstrate that effective communication is essential for successful crisis management. Communication influences public trust, stakeholder behavior, organizational reputation, and ultimately the success of crisis response effort. The studies also show that rebuilding trust is much more effective than denying responsibility. Future crisis communication should focus on transparency, accountability, stakeholder engagement, and continuous evaluation to improve preparedness for future emergencies. Thank you.